Hey, Sullivan County, it's Kat Scott, and I'm back again with an update about the ongoing shenanigans at our Sullivan County and our care center at Sunset Lake. Tonight, I am joined by Ruth Wallace. Ruth is the daughter of Raejean Wallace. For those of you who may not have seen Raejean's video this summer, Raejean um, filmed a whistleblower video from one of the facilities that the Grand Healthcare Systems owns and operates in Rome, New York, talking about the neglect and abuse that is happening right in front of her eyes. That video went viral. It was a bit of a news sensation, and her daughter Ruth and other concerned family members and community members in that community had a pretty large protest. And since then, they have been advocating for other residents in that nursing home and other nursing homes across the state and other states, because as Ruth is advocating, people are reaching out to her from other places. So what we're going to be talking about tonight is specifically Ruth and her mother's experience with the Grand, because the Grand healthcare system is on the short list to lease the care center at Sunset Lake. So those of us here in Sullivan County need to pay attention. This is pertinent information that pertains our community. But we're also going to talk a little bit about elder rights, abuse and neglect. And this is a very vulnerable population. And what we really want to concentrate on is how we want our elders to be treated at the end stages of their life. And not just elders, disabled people, because there are people who are younger who end up with diseases or accidents that tend to end up in these rehab facilities and long-term care facilities. So, Ruth, thank you tonight for joining me, for volunteering to tell your mother's story for her and your story, and getting the information here to our community in Sullivan County. So, Ruth, I just want to get a little background on you. You actually worked in long-term care facilities as a certified nurse's aide. So you told me that you took some CNA classes in BOCES and then went on to become certified in St. Luke's up in Oswego.
Correct.
Correct. Okay. So what was that certification process like? How long did it take you to take the classes to become certified in New York State?
So when I took it, which was a little over 20 years ago, it was a 6-week course that St. Luke's offered, which was an extremely in-depth program for nurses aides. And so I know that New York State has changed that for, well, they changed it during the pandemic, where they were stating that you could become a temporary nurse's aide and hold that temp certification for 4 months. And they were doing that with an 8-hour class, which the Grand in Rome was doing.
Okay, so we want to compare 6 weeks of classes to an 8 hours.
Correct.
Okay, that seems like there's a deficit of training and experience.
Yeah. In the middle of a pandemic, I think that if anything, I know that there was a major need for more healthcare workers, but it's incredibly dangerous during a pandemic when our most vulnerable population are the ones that are losing their lives, So I think if anything, additional training probably should have been required, with PPE and, how to protect themselves, the worker, as well as the resident.
Now, when you were receiving training to be a certified nurse's aide, did they talk about abuse and neglect issues? Was that something that you were trained on? Like,
yes, actually, and that if you witness something, you have to say something.
And how much training, how many hours do you think you received in training about neglect and abuse?
I would, it was a long time ago. It was at least covered, over the course of several days.
Right. So you could almost say maybe 8 hours worth.
Absolutely. Yeah.
Right. So it took
and abuse, because there's many forms. There's intentional and there's non-intentional, and I think a lot of what was happening at the Grand, they're extremely short-staffed, and if you're a resident that's working, or I'm sorry, a healthcare worker that's working overnight, a nurse's aide, and you have 40 residents to take care of, how can you possibly do that and remember who's on a bedpan, who isn't on a bedpan, who's already been changed? It must be extremely difficult.
Right. So you became certified and you worked in the industry for 10 years.
Correct.
And where did you work? Or
I worked in both Oswego and Onondaga County, a couple different nursing homes in Oswego County and a couple of them in Onondaga County before deciding that I wanted to do private home care.
Okay. And why did you leave? Why did you decide to move on?
It is a difficult job. I commend our certified nurses aides that are doing it because it's backbreaking. And I ended up with some back problems and some herniated discs. And so it's too much for someone to do that for many, many years with, significant back issues.
Okay. And I've heard that from some of the certified nurses aides that I know, some of the CNAs that I know.
Hmm.
They end up with back issues. So right now, I just want to give everyone a little bit of update. Your mother's home with you,
Hmm.
and you are able to take the time right now because you're laid off to care for her at home.
Yep.
What is your mother's current health status?
My mom is terminally ill. My mom was diagnosed with liver cancer a little over 2 months ago. They did find various spots that there was a spot on her lung we chose not to biopsy. So we do believe that it has kind of taken over her body. Once we knew that the end result was going to be the same, we stopped putting her through pain. Why continue to have more biopsies done when it's not going to change anything? There's no treatment options available. So it wasn't going to increase her time here with us. So we wanted to stop putting her through more tests.
That's understandable. And I'm sorry to hear about your mom. I'm sorry that that's the outcome. Let's talk about her health condition that led her to become very experienced with our healthcare system and some of these long-term, short-term care facilities. So you told me that your mom was diagnosed with cardiovascular disease when she was in her mid 30s.
Correct.
Um, and that led to her having ongoing health issues. And actually, you just told me when she was first diagnosed, the prognosis was that she'd be in a wheelchair within 5 years.
Yeah, that was their assumption. They thought that it would move much faster than it did. And really, I mean, my mom wasn't wheelchair dependent until maybe 5 years ago, and still she could walk some with a walker. So when she went into the Grand, it was actually for short-term rehabilitation. But our thought was it would be 6 to 8 weeks, maybe 5 weeks. It always varies, depending on how much work you put in and how much work the facility puts in. But she was in the Grand for 13 months.
Okay. So how long? And I just want to give people a little bit of background. You and I talked about this because my mother had a stroke, and when she had to be placed for rehab, what you don't know is you think, oh, well, just pick a place and I'll put my mom in there, and that's not how it works. They they allow you to pick a list of facilities that you would be okay with sending your loved one to, or you would go to, and then these facilities get to make a bed offer. They get to tell you if they're willing to accept the resident, the patient resident, and so it's out of your hands at that
Correct.
point, right? So you
Yep.
pick, but then it's out of your hands, and your loved one ends up going to the first person who has an available bed or makes an offer,
Hmm.
right? Um, so your mom ended up in the Grand in Rome,
Right.
and she was there for short-term rehab.
Hmm.
And short-term rehab is usually, I, I don't know, correct me if I'm wrong, but it's usually like, is it 90 days?
90 days or less, I would believe is typically still standard. I would have to look into that a little bit, but she shouldn't have been there for 13 months.
Right,
And
because when
she
my mom went for rehab, they told us, well, her insurance, her Medicare, will pay for, I believe it was 90 days. And then after that, they're no longer considered like short term. And we had to fill out Medicaid for my mom because we knew my mom needed 24-hour care. So it's interesting to me that your mom went in for short term rehab care and ended up there for 13 months.
correct.
Um,
And she just continued to go downhill. I don't think the pandemic really helped things. We weren't able to gain access into the facility. Um, and as far as window visits, they were going on for quite some time, and we didn't even know they were going on. And when I did find out, when an aide told me that, I'd asked for her to check on my mom, and she said, "Well, I have to help so and so with a window visit right now." And I said, "What do you mean a window visit? There's window visits going on?" And she said, "Oh, yeah, they've been going on the whole time. We were never notified of that." So I scheduled an appointment immediately to do a window visit with.
And another thing that I think it's important to point out is that your mother is perfectly intact cognitively. She has no issues with dementia or Alzheimer's. She is perfectly,
Was able to
capable.
hear. Oh,
Yeah.
there you go. I cut out there for a second. I couldn't hear anything.
Oh, okay. So she's perfectly capable of making her own decisions, of advocating for herself, of having conversations, asking for care when she needs it. And she's had this medical condition for quite some time. You said 27 years. So
Mhm.
tell us a little bit about her experience in that 13-month period at the Grand in Rome.
The Grand is cosmetically a beautiful facility. So, I mean, if you look at pictures of it, it really is one of the, on paper, as far as like how it looks like a stunning facility. And one of their messages, their voicemails, it says it's a stay at the Grand is similar to equivalent to a vacation resort. My mom didn't feel like she was on vacation, and it didn't feel like she was in a resort. There's some amazing healthcare workers that work in that building. There's not enough of them. And certainly people slip through the cracks. So there were definitely people there that verbally abused my mother. They would tell you that my mother verbally abused them. But if somebody tells you to go yourself or calls you this or that, you are allowed to stick up for yourself. And my mom finally got to the point where she just got tired of it. And the director of nursing was involved in one of those incidents where the lady, said a lot of four-letter words to my mom. And basically, my mom did not have her terminated because the woman had a family, and so she continued to work there. And I could name another 20 incidences that happened, but at the end of the day, it shouldn't take 7 phone calls to get my mom put on a toilet. And they would tell me, well, she always has to go to the bathroom at dinner time. Sometimes I do too when I'm 40. I have a 40-year-old bladder, not a 64-year-old bladder. So, I mean, I guess toileting was a huge issue. Hygiene was a huge issue. Um, Showers, baths. I spoke with an aide one day and I said, can my mom have PM care? She said, no, she had AM care. Well, you shouldn't have to choose whether or not you're going to smell in the morning or smell in the evening. How difficult is it to just wash her up and put her into bed? These are things that I did every day, when I was working in the field, and that many other people do on a daily basis. But as I said, there's some great workers in that building. There's also some that are there for a paycheck and not because it's their calling.
Right. And how did that affect your mom emotionally? How did that impact
Um,
her?
Not well. My mom became very depressed. In some of her posts on Facebook, I could tell that she was becoming more and more depressed just because of what she was going through, what she was seeing. She just kind of felt like she was ostracized, and a lot of things are shared with the residents there that shouldn't be due to HIPAA. I mean, there's a resident there that constantly was posting online about 2 of the gentlemen that passed away. After my mom's video went viral, these other family members started reaching out to me, explaining their stories. And this one resident said, well, of course they didn't transport him. He's a DNR. And of course they didn't transport him. He's a DNI. And you're not allowed to tell people another resident's status. There's just so many HIPAA violations within that facility. And if you were to listen to the interview that we did with the Sullivan Times, one of those HIPAA violations was brought up during that interview. And I actually have the paper that she had sent me in regards to that. And, airing someone's personal business on Facebook or posting videos of a resident on Facebook when the family clearly said no is terrible in nature. And it's against their rights. And, for the Grand to respond to those interviews and say that, quote unquote, it was wholly inaccurate, I would like them to point out which parts of that video were wholly inaccurate, because I have the paper that says that, the Division of Civil Rights was involved. So that's not wholly inaccurate. And, the woman that found Sharon when she walked in and found her father deceased in the dining room and cold, that's not wholly inaccurate. So I guess wholly inaccurate is the response to a lot of things. But in my experience with the Grand Healthcare, they're very much blame shifters. They're not good at taking responsibility. And I think sometimes it's better to take responsibility for what you've done wrong and how you've wronged people, apologize, and try to move forward. And I think a lot of people just wanted them to say, hey, you know what? We dropped the ball. We should have called you when there was a status change and your father was not breathing well. Instead of you finding out when he was on 15 liters of oxygen with a non-rebreather. Upon arrival at the emergency room, the man was in critical condition. But there just wasn't a lot of accountability.
I did watch both of the interviews that the Sullivan Times did with you and other family members of residents and former residents. And I was kind of shook, really, by just the stories. And having my mother, who is 80 and has dementia, my mother is very difficult. In a nursing home, it really kind of terrified me because I trust the staff that she has now. We've been with them for 4 years. They're like family. And my fear is that if the Grand, it gets this lease, that they will start thinning out that staff and my mother will lose her support system and she will either be neglected or abused because she is a difficult case.
Mm-hmm.
So listening to Rosemary talk about her father calling her in the middle of the night because he was sick and nobody would go and check on him, and she had to call for hours just to get someone to go into his room and check on him, and then had to call an ambulance. Like 4+ hours later, she took it upon herself to call an ambulance to get her father to the hospital. And at that point, he turned out to be COVID positive, correct?
Correct. He was COVID positive.
And the nurse who couldn't go in to check him because she was not well, she ended up being COVID positive, correct?
That's what we heard. I can't
Oh,
verify
you
that.
can't verify that. Okay. All right, that's what we heard. But Rosemary's father, what was his name? Do you know what Rosemary's father's name was?
Yes, his name was Leonard Vetter.
Leonard. So
Mm-hmm.
Leonard reached out to his daughter in the middle of the night because he wasn't feeling well and he couldn't get anyone to come in and aid and give him assistance. And it took her hours. And I could tell, I mean, as any child would be, that I could, because Leonard passed from COVID. I could tell by the way she was speaking that this is something that has deeply affected her to this day.
Mm-hmm. The wound is still very fresh.
Leonard had a roommate at the Grand. And what was his name?
Michael Grafazzi.
Michael also had COVID, didn't he?
He did, yes. They died 8 days apart.
8 days apart. And by the time Michael's daughter was, and who notified Michael's daughter? Was it the Grand? Did the Grand reach out to Michael's daughter to let her know that her father was not doing well?
No, she reached out to the Grand.
She reached out to the Grand.
She hadn't heard from her dad in a couple of days, so she reached out. And upon reaching out, they said, he's not feeling well. And that's when she got, I believe, a nursing supervisor or charge nurse on the phone that they had said that, you know, he's on oxygen, and her father was not oxygen dependent prior to that. So she had some concerns and she said, how many units is he on? And they said 15 liters with a non-rebreather.
For people who don't understand how much oxygen that is, that's a lot of oxygen. My mother has chronic obstructive pulmonary disease. She's had it for 20 years. And my mother's very fortunate. Hers is not horrible, but my mother is on 2 liters of oxygen. When she needs oxygen, she's on oxygen. 15 liters of oxygen, that and a rebreather, it was almost like he was not really breathing, right? I mean, we're not doctors. I know we can't say that. But his daughter is a doctor, isn't she?
She is an MD, yes.
She's an MD.
She works in the pharmaceutical side now.
Okay.
But yeah, she is, she's more on the pharmaceutical side now. But yes, she is, Marissa is a medical doctor.
Does she have a specialty?
So she was involved, she's involved with a lot of, sorry, I have rescue pups.
That's okay.
She's involved with a lot of different medicines, vaccines right now. I know that COVID is very close to her heart for losing her dad. I guess when you speak with her, I'll let her go on about what she does in her
Okay.
exact field. I think it'll be good to hear it from her because she can
Yes.
just go great length about it. But she knew at the moment when she heard her father was on 15 liters of oxygen with a non-rebreather that he needed to be transported immediately. And from there, she contacted the attending ER physician and spoke with him and explained everything she had just heard about her father's chest x-ray, that he was on 15 liters. And sure enough, when her father arrived at the emergency room, he was in critical condition. A direct quote out of his medical chart states, 15 liters of oxygen with a non-rebreather. We'll continue to monitor. They were going to leave him there and let him die.
At the Grand. The Grand realized that he was on 15 liters of oxygen with a rebreather and decided to just monitor his condition.
Correct.
How long did he last after he left the Grand? Do you know how long?
I believe it was only a couple of days. I know Marissa would be able to give you obviously exact days from the time he went to the hospital, but him and Leonard, who were roommates and friends, passed. They died 8 days apart.
And for those of you out there watching, I am going to be talking to other family members of residents. Ruth has graciously offered to put me in touch with the people that she's been talking to, because I think we need to know what we're dealing with down here in Sullivan County. When the Grand shows up and puts on a good presentation, I think we need to understand what they're not telling us. A job application is a great thing. We all put our best foot forward. We show up at a job interview. We don't talk about the ugly bits. And it's going to be up to this community to vet them on our own, if we want to protect our own. And that's why I'm interviewing Ruth and other family members, because I think this is vital. I think in this industry, you have good actors and you have bad actors. And I believe the Grand could possibly be a bad actor. And they have several facilities. I think they have a few facilities that are like 4 stars, but they have a lot of facilities that are like 2 stars and 3 stars. Do you know how long they have owned and operated the facility in Rome?
I don't. And you and I had spoken about that in a previous conversation, and I was going to get an exact date for you. I know that prior to that, I had heard amazing things about that facility and that it was a great facility. When I had spoken with other employees, they said it was a great facility to work in, to be in. The morale was wonderful. And it's not to say that that never happened there after the Grand took it over. We didn't have that experience. And if we were to take my mom's experience completely away, the Grand says, we're lying, we make things up, they can say whatever. I'm okay with that. I sleep just fine at night knowing that we're not lying. But if you take Raejean Wallace out of the equation, you take me out of the equation, what about all of these other families? So are you telling me that there's no truth in anything that any of these people are saying? Because when I held a protest there, I can tell you there were direct quotes out of medical files. So how is it all wholly inaccurate? How is everyone lying? Did we lie that Michael Grafazzi was laying there on 15 liters of oxygen with a non-rebreather when they were going to quote unquote continue to monitor? Nope, that's a fact. Did Rosie lie when she said they didn't call her of a status change? Her father had to call her and say that he was sick? No, that's a fact. Did they get in touch with Hope? Did they get in touch with, yes, did they get in touch with Leela's family prior to the funeral home calling? No, they didn't.
We haven't touched on that story yet, and I do want to touch on that story. Tell us about Leela.
So I was actually sitting next to my mom when she was in the hospital, one of the times she was in the hospital, and I received a message from someone that was close to her asking if, I guess not her biological daughter, but she had raised her for, 20 years. And Leela was in a relationship with the young woman that reached out to me with her mother. So she had been a part of her life for a long time. So she reached out to me and said that she wanted to speak with me in regards to, Leela's death. And I said, oh my gosh, I'm so sorry. I said, I'd love to talk to you. I said, was it COVID? And she said, no. And I said, how long ago did she pass? And she said, Friday, or, a couple days ago, essentially. So it was very, very fresh and very new. So upon speaking with her, we found out that, Leela had a quote unquote accident in physical therapy, supposedly. I wasn't there. I can't vouch for that. But There's a lot of unanswered questions, I guess. I know that certainly you can die at any time. You can die sitting in a chair, you can die while you're standing up. But there's a lot of things about that story that really didn't make a lot of sense to her or me, or, the many other people that are on the panel that I, discussed the death with. And so I was able to take a look at some photographs that she allowed me to look at, and I have even more more questions. But I guess, I'm not in law enforcement and I'm not a doctor, so I can't say how she died, and I wasn't there. But I can say the description and how they're saying she died seems highly unlikely. Unbelievable.
And when was this? You said you were with your mom in the hospital. Can you give us like a time reference?
This was within the last few months, like maybe a couple months.
Couple months. So in latter part of 2020.
Correct.
Now, Leila died. Did the Grand call? I would assume that this. I'm sorry. You said Hope. Was Hope listed as Leila's like person of contact or?
The Grand called and left a message, but the message was left after they had spoken with the funeral home. So the funeral home called and spoke with Leila's partner and explained that, they had her. So, there was plenty of time, I think, for the Grand to call. I mean, this gentleman already went and took the body. So by the time he reached out to them.
So I just want to get this straight. So Leila's in this rehab and Hope's living her life thinking that Leila's getting her treatments and everything's fine until they get a phone call from a funeral home saying that Leila has passed away.
Correct. They had actually spoken with her just prior to her going to physical therapy that morning. And she said that, she would contact them after she got back from physical therapy. And they didn't hear from her. They figured they'd hear from her later in the afternoon, but then they received a phone call from the funeral home.
That's horrible.
Mm-hmm. Yep. And after that, they listened to the message, which I believe she did send me that as well. So I have listened to that message stating that, quote unquote, Leila took a turn in physical therapy. I don't know if they meant that figuratively, literally, but so she said, please call me back.
And the details of what they told Hope of how this accident occurred don't quite measure up to the photographic evidence that you've seen and that Hope, well, you said Hope went to view the remains. Hope went to view Leila's body.
Her partner did. So
her
Hope
partner
is
did.
her daughter, yes. Hope is her partner's daughter. So it was, I guess, what was said of how it happened and the photos, it just doesn't make any sense. I guess what they were trying to say is she stood up, fell back, and died. And I just don't think that's possible. I witnessed the pictures, and there's too much. There's bruising on. There's just too much. Not to get too in depth with the pictures.
No,
but,
I understand.
It's not. I mean, they're not my pictures to really speak about. But I can tell you, just falling back didn't happen, based on the face.
Okay, that's really disturbing to me on a lot of levels. As family members, and I correct me if I'm wrong, but as caregivers, as family members, we heavily rely on the staff to communicate with us when there are issues, when there are accidents, when there are, like my mom has had like a rash that they've called me about, just to let me know that there's been a change in her condition. I don't know what I would do if I did not have that level of trust.
Yes, status changes are something that they're not great with reporting. They would send us out letters with the COVID numbers on there stating that, if your loved one has a status change, verbatim on these letters, we will reach out and contact you. And well, I didn't find out my mom had COVID from them. I found out from my mom, who tested positive in the hospital, because they really weren't giving tests. And their business development agent, Jay Lawrence, who I spoke with on Easter Sunday, 2020, said, we're treating all of the residents as if they have COVID. Well, that's wonderful and very kind. But But let's be honest, the Grand Healthcare was doing that to save face. Their numbers were going through the roof in so many of their facilities. The last thing they wanted was to find out that, 112 residents tested positive within this facility. Or, look up their Barnwell facility. You don't have to take anything I say at gospel, but do a little research and look up the Grand at Barnwell. Read some of those articles, because you won't sleep well at night. You won't sleep well knowing that this healthcare company wants to take over a nursing home that your loved ones are in, because the level of care that your loved ones are receiving now at the care center, from what everyone tells me, is exceptional. And I love hearing about those types of nursing homes and, those types of experiences, because I don't get to hear about them very often. I advocate for people in facilities across the state of New York, but the consistent calls that I get are about, they're about residents that reside in the Grand. There's Medicaid and Medicare facilities are not Carnival cruise ships. They're usually not top-notch facilities. So these things certainly happen, and they've happened in other facilities that my mom was in. That being said, the consistency of the level of accidents or, abuse, neglect, bad hygiene, verbal abuse, it's just very consistent with this healthcare company.
Let me ask you a question. When COVID was first happening in the spring and your mom was a resident, how were they communicating about the COVID numbers? Were you getting an update about how many staff were testing positive, how many residents were testing positive? Was that a transparent process?
It was actually, the process of it with the letters and the phone calls, I think I can give them a plus on that. Because we did receive letters and we did receive phone calls giving us an update, that the facility is still closed down, and, no new positive tests today, or there were positive tests today. So I will say that is something that they did very well. But you would get the letter and you would get the phone call. As far as getting the personal call to say, hey, your loved one has this, or your loved one has a UTI, or your loved one hasn't eaten in 3 days, or your loved one seems to be off or dehydrated, those are the calls that didn't come in. And those are the calls that needed to happen. We needed to be alerted of status changes and needed to be alerted when somebody was getting sick or had symptoms. Instead, it was just, you get the formal letter, or, the informal letter and the daily phone call.
That was just talking about COVID.
Correct.
Okay.
A pre-recorded message, so to speak.
Oh, so it was like a pre-recorded message.
Oh yeah, it wasn't like a personal phone call with
So
someone
it was
calling.
Automated.
Oh, absolutely. Yes.
Okay.
Mm-hmm.
And they would give you actual numbers, like we have 12 residents positive for COVID.
They would say yes. Well, no, they would say we've had positive cases today. We've had positive tests today.
Okay, so they would tell you they had positive cases or tests, but they weren't giving you specifics like numbers.
We didn't know as far as how many staff members and stuff. That was something that they weren't sharing. I mean, we knew staff members were testing positive. I can name various staff members. One of which was a really sweet lady that lost her life there. Those workers were working crazy hours. And like I said, there's some great healthcare workers in that building. Not all of them are, but there's a lot of really good ones. My mom had one that, I think if she could have traded me in for her, she may have, because she loved her that much, but she only had her, once a week for an 8-hour shift. And then, it was, or twice a week. And the other days, you don't get that lucky all the time.
Let's talk about something, because you were actually a certified nurse's aide. You were a CNA, so you've worked in facilities like this. Because one of the things that I am also advocating for is the staff. How hard is it on staff members when administration or facilities make cuts or understaff?
I believe that the Grand Healthcare puts profit over people. And that's not just about residents. I mean, it's profit over the people that work for them. I could share many different screenshots that I have from various Facebooks of employees that say the only people that were treated worse than the employees were the residents. So it's not, it's corporate greed. I can't imagine working 16-hour shift after 16-hour shift after 16-hour shift for a company that really doesn't appreciate me. And, they can put on a fancy song and dance when they do their little display for all of you. But at the end of the day, this is their workers that are saying, yeah, they treat us like garbage. It's sad. You're busting your butt for what? Minimal pay?
And the Grand healthcare systems, they were involved in a lawsuit because they were not paying their employees correctly, right?
Correct. That was a couple $1 million. And then most recently in 2020, they paid out some big fines too, $22,000 for one facility, $8,000 for another facility. Look up the Grand at Chittenango, COVID, fines from New York State, our Department of Health fines. And that was due to an employee walking out of a COVID positive patient's room wearing the same PPE into a COVID negative patient's room. And so COVID is, it's scary, and the pandemic is scary, but it's really scary when the healthcare system that runs all of these facilities, lack of training. We talked about that, an 8-hour nurses aides class. How would some of these people know I got to take this off? I mean, you would think it would be common sense, but I don't know how they teach someone in 8 hours how to pivot and turn and toilet and do bed baths and full bed changes. That stuff takes a long time to learn. And I'm not sure how you learn all of that in an 8-hour class.
Right. I mean, it's also, one of the things that I learned with my mom is about how to not cause infections, how to not cause UTIs, especially with people who are incontinent, right? How to effectively change somebody, or how, you were talking to me last night about double diapers. What is that? Let's talk to people about that.
So
Let's talk to people also about the, did you say it was the Dignity Act?
Yeah, so there is a Dignity Act.
There's a Dignity Act.
Yes, there's a Dignity Act. Double diapering happens in facilities. It's disgusting. It's inhumane. It's basically where they'll put like a Chuck's pad inside of a diaper. I can't tell you that this has happened at the Grand because I haven't changed a resident at the Grand.
Right.
But I can tell you that working in facilities that were very, very short staffed, I would watch people cut corners. There was a facility that I worked at in Onondaga County where these corners were being cut and they were washing people up, tossing a Chucks in there. And I noticed it because when I came onto my shift and I had to change someone after someone that I viewed as being a wonderful nurse's aide, I had to pull Chuck's pad out of the inside of the diaper because they were double diapering. And it does happen. And then skin breakdown happens and bed sores happen and UTIs happen. We spoke about the Dignity Act. We had a resident that we advocated for that actually left the Grand, and my partner that assists me with all of this stuff and runs the elder abuse site with me, she advocated for this woman and she got her transferred to another facility, and she soared through rehab. That was not happening when she was at the Grand. So again, you take my mom out of the equation, look at other residents. Why is it that this woman was having a terrible time and being told to poop in a diaper when she was toileting before she ever went into Grand? Why would you force someone to go to the bathroom in a diaper? That strips someone of dignity. This is the one that was used to using her restrooms like you or I, and she went there and said, just go in a diaper, put a diaper on her. So when she got to the other facility, the lady said to her, the nurse aide, who was actually one of my insiders at the other facility, gave her a call, just bring the coffee just to get you to the bathroom. And she said, you don't have to use the diaper here. You don't have to pee and poop in a diaper. And she said, why'd you go in a diaper? But you're going on the toilet. And she said, yes, at the Grand, they made you can't go in a diaper. There's a Dignity Act that strips people of their dignity. It's sad and it's disgusting. I wouldn't want to be told to go in a diaper if I could use the restroom. I guess in the end stages of life, when you're getting up there in age or, you become disabled, you want to be able to even do minimal tasks to feel like you're still some worth,
Yes. Yeah. That would be humiliating. And it's just because they're understaffing. So if the staff is not able to do the work that I'm sorry, I think I'm getting a little feedback. And before, when you were speaking, there was a little, is the recording okay on your end?
It's a little bit fuzzy.
Okay.
And it gave CPU usage is high, so that was about it.
Okay, so bear with us, folks. Technical issues. I apologize. But yeah, dignity is important, especially at your end stage of your life, because your body is failing you and betraying you. Society has cast you aside and told you that you are no longer relevant. And you're living your last days. So dignity is something that's really important for these residents. And this one was just there for rehab. She was not there for long-term care. She was just there to im- improve on something to go back home.
Correct. Yes. So she had stroke, so she was there to regain some of her mobility,
Okay.
so that she could go home. And she is actually home. She's been home since November, and she's doing great, and she's making strides at home. And her and her wonderful husband have been married for 50 years, have the perfect love story, and we are incredibly happy they're back together. Um, and they're super sweet couple, and we like happy endings. So she was transferred out of that facility, moved to another facility that was better suited for her, with better staffing levels, which is something that I'm pushing for, not just in the Grand, across New York State. For part of healthcare reform is to get these nurses and nurses aides more help. Companies that are all about making money are certainly only going to staff their facilities at the minimal levels that New York State mandates, and those minimal levels are not enough. These ladies and gentlemen are going home with sore feet and sore backs, and the residents being, they're just not being cared for in the same capacity. If an aide has 40 residents overnight as opposed to 20, those 20 are going to get better care. It's not rocket science.
Right. It's not. It's not rocket science. And for my mother is an extensive lift of 2. So that means 2 CNAs are in there to help her, whether it's to get from the bed to her wheelchair, to help her with showering. So if you have 40 residents and you have 1 CNA on overnight and something happens with my mom, then what happens?
So they would call in a nurse, or they would call in another aide from another wing. So like at the Grand Rehabilitation, there were 4 wings. So let's say there was 1 aide on for my mom's wing, which is 40 residents. And they needed to, take care of a 2 assist. Hoyers are 2 assist. A resident like your mom would be a 2 assist. Anything like that. They would have to either have nurse assist, or they would have to have an aide come from a different wing.
Okay. And one of the things that we talked about was that there are different regulations, right? So like in my mom's facility, it is a publicly owned facility. So there is an RN that is there.
Yes. So in your mom's facility, I mean that an RN is there 24 hours a day. And depending on which facility you look at, like there's a facility in my town where I would have loved to have on that nursing home. Unfortunately, she couldn't go to that nursing home because she has a tube that's sticking out of her stomach. It's called a chole tube. And it's placed by, her liver area. Due to that tube, any facility that my mom went into would have to have a 24-hour RN. And on top, which is difficult, only certain facilities have 24-hour RNs, and only certain facilities take residents with chole tubes. And then on top of that, my mom would be considered a bariatric resident due to her weight and size, meaning that I'd have to find a facility that had a bariatric bed, and they're not abundant. And then when I found a facility that had an open bariatric bed, I also have to make sure that they take someone that has a chole tube. So placing her is incredibly difficult.
Let's talk about your mom's condition, because when she was in the Grand, she was there for 13 months. You told me she did not see a doctor in 13 months outside of the Grand.
She was not going to doctors. I mean, not that she was seeing doctors at the emergency room when she for blood transfusions and stuff like that. As far as like her appointments, no, she kept missing, and they were doing telemedicine. I know that was part of the thing for when COVID started. A lot of specialists were in anesthesia and in surgery, so they would do telemeds, and the telemed continued to get canceled. And then I received a phone call from a charge nurse at one point asking me if I had scheduled my mom a hematologist appointment. And I said, what do you mean? Why would I schedule her a hematologist appointment? And my mom is in your facility. So any appointments with specialists or primary, that's through you. I just couldn't believe it. She called me asking me if I had made an appointment for my mom at a hematologist because it was kind of shocking.
So you sent me some photos of your mom's condition. Were these photos, were they not sending her out for care?
It was very difficult to get them to transfer her to the hospital, and I called and complained. Numerous times I actually myself called an ambulance, or they would call me saying, "Mom wants to go to the hospital. We don't think she needs to be sent out." I'm like, "No, send her out." And, sometimes she would go and she would need a transfusion. Sometimes it would be something else. Sometimes it would be a urinary tract infection. But I felt like every time she went, putting another set of eyes on her certainly didn't hurt. I encourage people to do that all the time. When they say, "I'm concerned about my mom, I FaceTimed her today. She didn't look well, and she was very lethargic, and she just doesn't act like herself, and she's not really drinking." And I encourage them, call the facility and see if they'll transport her out. The facility says no, you still have that right.
Right. So I want to share some pictures. I just want to warn people that they are graphic in nature. This is a health condition that was going unchecked. And Ruth, when I show these pictures, are these pictures that your mom took and then you guys sent her out to the hospital for treatment?
No, a lot of the pictures I actually took when my mom had gotten to the hospital in Syracuse. Some
Okay.
of them were pictures my mom took, and I can kind of tell you the difference.
Okay. So I'll share some of the pictures and let's just talk about them. And again, these are graphic. So if you want to skip over this portion, then do so if this will negatively impact you. But for some of you out there, I think we need to see graphic and we need to understand the breadth of what's happened, because a woman lived this. She experienced it. And that's what this whole conversation is about. So a lot of times I like to think that if someone else suffered through it, then so can I, just by witnessing it. So I'm going to share these pictures now. Okay. Can you see the screen? Hold on. There we go. Can you see the screen now?
Yes.
Okay. So this is your mom's leg?
Yep, that was when my mom was in St. Joseph's.
Okay. And this is her at the hospital.
Correct.
And she has some blistering and some wounds.
So if you look, and I believe that one were starting to heal up there. I'm going to look at the picture on my phone as well where you're doing, so I can give you a description when the photos were taken. I think that would be very much effective. So let me just pull that up here. So that one that you have on there right now is September, I think. Yep, that was taken at September 29th, 2020.
Okay.
So my mother was in the hospital at that point. I assume in maybe I'm trying to think of them. Maybe Rome Hospital.
Okay. And so the blistering and these wounds did she leave the Grand with these? How long had she been in the hospital?
September was just, I think that was a short stay. My mom, when this happens, it means my mom's retaining fluids. My mom is she's on basics, and her weight is monitored, and obviously she's retaining more fluid, basics have to go up.
Because that's part of her condition. She retains fluid and her vascular system is not able to push the fluid out. So this is something that she has to be monitored for.
Correct.
And this is something that a skilled nursing unit should be competent enough to monitor and appropriately treat.
Yes.
Okay. So when your mom was sent out, I have a picture here of her leg. And I have a weeping wound. What's with her? What happened with her foot, her toe here? Is that a blister?
That's cellulitis. That was from back in April.
Okay. So
As was that April 10th. And the next one was the one that was April 11th.
Okay.
That was taken in St. Joseph's Hospital. And yes, that was taken on September 29th at 12:57 p.m.
Okay. So I'm going to stop sharing now because I think we've given people some stuff to look at. So when your mom was transferred out of the hospital, you told me they took 140 pounds of fluid off of her body.
Yeah, it went over the course of a few weeks. The issue is, her body retains fluid quickly. So, I mean, it all comes back on little by little. But my mom, when I got the call from the nurse practitioner from the Grand stating that she was going to transport my mom, she felt it was that she needed to go to Syracuse, that Rome Hospital didn't feel comfortable diuresing my mother. In other words, getting the fluid off my mom. So my mom was sent from the Grand in Rome to a Syracuse hospital.
When she was in Syracuse, did the doctors say that maybe she had been sent out sooner?
Well, that there was an abundance of fluid. I don't think they would have said, they should have done this differently. They should have done that
Right.
differently.
Because
But I spoke with the nurse supervisor the night before my mom was transferred out. I was incredibly concerned over the size of my mom's legs. I made my mom send me pictures of her legs all the time because I wanted to see how she was retaining fluid. And I said, I'm very concerned. And he said, no, they look about the same size to me. I said, I'm very concerned. And he said, well, what was your weight today? And my mom's like, what do you mean? And she said, they haven't weighed me. The scale that was, they tried to weigh her on had like tipped sideways with my mom on it, which was probably something due to weight. So after that, they just were writing down that she refused. They never told my mom that they could have just weighed her in her wheelchair at the end of that hall. So in between that wing and the other wing, there is a scale there where all they do is they just push her on it in the wheelchair, meaning she wouldn't have had to stand up. They could have just weighed her in her chair. So that was never mentioned. And so when I spoke with the supervisor, Jim, he had mentioned this scale. My mom's like, why wouldn't they tell me? So my mom hadn't been weighed for a very, very long time prior to her leaving the Grand.
So they weren't really monitoring her condition if they weren't weighing her.
They weren't. No.
Oh, you froze up a little bit.
Oh,
Gosh, guys, I'm sorry. I don't know what's going on tonight. Probably because this is super important and I need the information to get out to you. So it's
do what happens.
the universe is playing. Oh, there you are. You're back. So I mean, part of monitoring, because my mother has been on Lasix before, which is a diuretic to help the body expel water, excess fluids. And my mother has to be weighed, and we watch her weight. And my mother does not have a condition that's anywhere near your mother's. Weighing them is very important. So I just don't want people to think like, oh, what's the big deal? They didn't weigh her. Weighing a resident or a patient who has a fluid retention disorder is important, because that tells you how much fluid they're retaining. And usually they weigh them like every day, every other day, they, depending on the severity of the case, to gauge how much fluid can be retained. Some people can retain pounds and pounds of fluid in a very short period of time. Like they can have fluctuations of 5 pounds, 10 pounds over a 24-hour period, depending again on the severity of the condition. So for them to not weigh your mother means that they were not adequately monitoring her very specific condition.
Correct.
Like the reason she's there is because she has a fluid retention situation, and they were not weighing her. So how would they know how much fluid she was retaining from day to day, week to week? And they did not weigh her for months.
Right. And then to add to that, my mom only has one kidney. My mom has lupus and she has one kidney. So I could go on and on. I call it the grand disaster. And because I just, it's easier to do that than to cry. But it is a disaster. It's a domino effect. And my mom is not the only resident that experienced that, and I hear about all of these people that came to me and said, my husband or my father or so-and-so fell out of bed. Oh, okay. Does your father have, does he normally throw himself out of bed? Did he fall? Did he roll? Oh, well, he's a Hoyer. So these are people that don't move very well. So how are all of these Hoyers falling out of bed, rolling onto the floor? Can it happen? Of course it can happen, but usually it's because they've been overrolled. Putting a Hoyer pad under someone, and a lot of times you can roll. it's easy to do that. That's why I said, sometimes neglect is not intentional. It's not like I think people going, that every single case is intentional. Sometimes it's not intentional. It's simply because you're rushing, because you have 40 people to take care of instead of 20. And you know that the girl that you have that's helping you with this 2 assist only has 5 minutes because she's got to help on 2 other wings with 2 other 2 assists. And so rushing and trying to get through the movements and get everything done, that's how things happen. Careless mistakes.
So, and I think that's an important point to make, because there is no such thing as perfection in healthcare.
Correct.
As people who have good experiences with facilities tend to think that that is a good facility. I'm guilty of it myself. My mother is I believe to be an excellent nursing home. Are there people who have had some negative experiences? Yes, but no one has ever come to me and talked about gross negligence or abuse.
Mm-hmm.
And I've had an issue or two, with my mom, and that's what we're daughters, we're caregivers, we're advocates. Our job is to make sure that our parents are cared for.
Right.
So of course we're going to disagree sometimes with things, and you're fortunate that you have an education and experience in this particular field. I don't. So sometimes, if somebody says to me, well, this is how we do it, I have to trust them that that's how it's done.
Right.
Or I have to do my own investigation and my own questioning. But one of the things I want to point out is that accidents do happen. Um, no one is perfect. Even if you're receiving good care, sometimes they can develop a skin breakdown or a rash. But the point I'm trying to make here is, what is the facility? How is the Grand, how they react to these? What is their incentive for not reporting these, for not coming clean about these incidences?
I think, I mean, I guess, a million different ways to view it. I think they don't transport people out. There's kind of like a report card, where the facilities get almost like a report card where, they want to try to take care of things in-house and not transfer. So I think they attempt to do that. I think sometimes they attempt to do it for far too long when people need to be transported out. I
Right,
think it's
because when
one
they
thing.
let's talk about the report card, because when they transfer somebody from the nursing home, from their facility out to a hospital, it's almost like they get a demerit for doing that, which seems
Correct.
counterproductive to care, to providing people with care. It's saying if you can't take care of them and you have to send them out to an emergency room, then you're deficient. But these facilities don't have CAT scans or MRIs. They don't have laboratories, right, on site. Do they have a laboratory on site?
My mother's facility did not, and I don't know of any of the Grands that. I mean, they have different parts of the Grand Healthcare where they have a stroke center and a cardiac center, that kind of thing. But as
Right.
far as their nursing homes, there is not a lab in their nursing homes that I am aware of. I know that in order to get X-rays, they can call in people to do X-rays and things like that. A
Right.
team they work with, but that's not something that happens ASAP. Like if you fall and
Right.
you need.
Right. My mother's facility has an X-ray machine. My mother's been
Mm-hmm.
X-rayed in-house. But I mean, recently people were pointing out that my mother's facility has 2 stars from Medicare.gov as far as um, resident care. And one of the reasons is because they send the residents out to the hospital. Now, and this is the point I wanted to make, was if you don't have a laboratory on site, and if my mother has a UTI and she's a fever and she's symptomatic and non-responsive, which is what happened on January 2nd, my mother was not responsive. They had to send her out to the hospital. She had a UTI. My mother has a huge kidney stone, and because of her stroke and some degenerative bone disease in her spine that's led to some neurologic issues, she has a kidney stone. So it led to this UTI situation. How are they supposed to treat that or diagnose it if they don't have a laboratory in house? Like if they
Very.
do, if they take a urine sample, they're sending it out to somebody else, and
Mm-hmm.
they're waiting for those results. If you go to the emergency room and they take a urine sample, you're getting those results back within depending on how busy the emergency room is, an hour, 2 hours. Like it's a matter of hours versus days.
Correct.
So it's kind of counterproductive, this rating system. It
Mm-hmm.
says you're not doing your job if you're taking the resident and sending them out to someone else to do something that you're not capable of doing.
Right. Yep. And a lot of the families that reached out concerned over, the lack of UTIs, quote unquote, on paper, knowing that there's UTIs happen in nursing homes, but the lack of UTIs that the Grand has on paper is they're undiagnosed or underreported. So if you look at, some of these people that have reached out that said, my father's catheter, his urine was burgundy. That's concerning. Or there's so many chunks in it. Not to be disgusting, but that's, there shouldn't look like, some of it was described looking like cereal, that there was pus in the bag. All of these things are clear indications that something is wrong. So when these family members reach out and they say, well, they're going to have the doctor see her tomorrow when he comes in, so he'll see her tomorrow. No, tomorrow. No, get her to a doctor tonight. Well, they told me they don't want to transport her out. They're just going to hold tight and the doctor's going to be there tomorrow. Why are we not transporting? I said, so then you call an ambulance. These people are don't always know the system. So, they're unaware that they can actually call an ambulance. I said, yes. And then they're going to tell your mom to sign this paper. And it says that she's leaving AMA and she has rights. She doesn't have to sign that. They would tell my mother to sign it. And I'd say, no, don't sign it. Don't sign anything. You don't have to.
So they wanted your mother to sign a sheet saying that she was leaving the facility against medical advice when she needed to go to an emergency room for medical treatment?
When they were saying that she was leaving there on her own, essentially, because I would call the ambulance or she would call the ambulance when they would refuse to send her. So they want you to sign this form, basically. And you don't have to. Nobody's forcing your hand to sign anything. And I think people need to know their rights and their legal rights. Nobody's going to put that pen in my mom's hand and hold her hand down and make her sign something. So the answer is no. And they kept saying, well, she has to sign this. She doesn't have to sign anything. She has every right not to sign anything you put in front of her, and I'm encouraging her not to do so. When I can't see what the paper says, why am I going to let her sign anything?
This is so foreign to me. My mother has been in the care center at Sunset Lake for 4 years this month, 4 years. This is so foreign to me to have to argue with staff about sending someone out to the hospital.
I hope it remains. I do. I hope you never have to go through that. And I hope that the other people that have ones in that facility, that the care continues. So whether it's over by another company or if the county decides to keep it, I hope that they receive the level of care that they're receiving right now, because I truly believe with everything in me, if the Grand were to take that facility over and we had this conversation 6 months from now, I think you would be in a much different place. And I think we would be having a much different conversation about how the care and treatment of the facility is as opposed to how it is today.
Trust me, since learning of the Grand over the summer and researching them and looking into them and then finding out they're on the short list, I have just a ball of anxiety, just a pit in my stomach. I'm terrified. Honest to God, I'm terrified because my mother is difficult. My mother is 80. My mother, I signed her consent. I'm her healthcare proxy. My mother is not legally competent any longer to make her decisions. And I discussed with my siblings about the COVID vaccination. And, we had a conversation about some of our concerns and we weighed everything and we decided that it was better for her to have it than not. And my mother had COVID and just by the grace of God, remained asymptomatic. But still, I'm concerned because we don't know enough about COVID to know if she got it a second time, would we be so lucky?
Right.
So we decided to, sign off on the vaccination. When they showed up with the needle to give her the vaccination, she told them to get the F away from her with that effing needle now. And I've been told by several staff members that she was quite emphatic when she said it, and they all get a giggle out of that because my mother is very spicy. She's half Sicilian, half Irish, and does not mind borrowing her ability to rage from either of her ancestry or genealogy. And I worry about that with her. My mother also was resistant to care. I worry about
I would worry about it to care, because I think that's something where, you told me you're so trusting of the people that are with her right now, and they'll tell you, she's here today, or they'll reapproach and attempt to get her to do it, by reapproaching a few minutes later. Like that's
Right.
something you consistently have to do with dementia and Alzheimer's patients. But I worry if, the next group of people that go in there are going to do the same thing. Are they going to constantly reapproach, or are they going to check her off the list as somebody that they didn't have to care for today?
That is something that I worry about, because I know that this staff, they do make attempts at trying to get her to take her medications. There's
Mm-hmm.
one nurse, God bless her, Amy, sweet, sweet girl. My mother has not liked her from day one. Day one. And if Amy is on and giving meds, a lot of times she knows, and she'll say to somebody else, hey, can you go into Francis and try and get her to give her pills? Because if she sees me walk in, she's just going to be a flat out no. And there's one
Mm-hmm.
nurse, Lori, who is kind of a battle axe in and of herself. And she says, oh, your mom takes her meds for me. I go in and I just tell her, Francis, you need to take your meds. You don't want to have another stroke. She says, I just tell her. And she knows what my mom responds to.
Mm-hmm.
And and I'm not even kidding when I say this. These people saved my sanity. My mother lived at home. She was not competent, but trying to get somebody declared incompetent is very difficult. And her stroke was just the needle that broke the hay that broke the camel's back. I'm really terrible at metaphors sometimes. But it was the tipping point for her. And the doctor said medically she cannot be on her own. She needs 24-hour care. And that saved my sanity, and brought on a whole new oh, you dipped down for oh, there you are. Brought on a whole new a lot of other worries. And then I met the staff and I got to know the staff, and they're like family to me now. And I sleep at night. I'm afraid that if the Grand is able to lease this place, that I will not sleep at night. Um, I don't think people understand how emotionally difficult it is to put a loved one in a nursing home to begin with.
I
There's a
don't
lot
think.
of guilt.
Yeah, I think you have to experience it firsthand to understand that. And then, there's always the guilt when you take them for an outing, or, pre-COVID, or when they come home for a picnic that you have to bring them back. All of these things are very concerning. I'm gonna have to wrap up here in a second, Kat. My mom is it is the witching hour. It is right around 7:30 mark, and so she needs me to do her night care. And So if we can maybe do a part 2 of this, continue this, and certainly get those other people involved to speak to you.
Ruth, I would love to do part 2. Your mother's very lucky to have you.
Thank you.
Not just because you love her and you care for her, but because you have the experience to give her the care at home.
And
Um,
I had the experience to bust her chops. She really likes that. A prank, and she pranked my son pretty bad yesterday.
you told me about that.
Yeah, he thought he put his hand into something that was not nice.
Life lessons from grandma, right?
Yes.
Um, I I appreciate the time that you're taking, especially since this is not your fight. Really, I mean, technically your mom's home, so this isn't your fight anymore. But you've taken this fight on for other families, other people, and that's what I feel like is, I know that I'm going to fight like hell for my mom, and if I fall down on the job, I have 3 other siblings right behind me that will do it. But I'm fighting for the people that don't have a Ruth or a Cat. Um,
Absolutely.
Fighting for the people who maybe their caregivers don't understand how the system works or what their rights are or how far they can push. For people who will fall through the cracks, I mean, we're talking about a man whose daughter was an MD and he fell through the cracks.
Oh, I'm
So,
sorry. My mom
no,
is yelling.
okay, Ruth, it's okay. You've got to go. All right, I'll do my own sign off. You can just go, Ruth. Just go. Okay, folks. So interesting conversation. Ruth is going to set up some additional interviews with additional family members who have had experiences with the Grand that are less than Grand. And I think this is important for our community. We need to help our legislators and this LDC board make this decision. We need to influence what they find to be acceptable, and let them know what Sullivan County will and will not accept. I do not believe Sullivan County will accept the grant as a viable choice for our loved ones at the care center. Thank you for joining me. If you have any questions, comment below or reach out to me on my Facebook. This video is going to be made available on YouTube, but I'm going to be placing it on social media. Think really long and hard about this, especially if you have a loved one who's elderly or sick, especially if you live in an area where you have limited resources. These are important issues. And it also says a lot about who we are as a society. It's very easy to walk away from this. It's very easy to say everything will be fine. Don't worry about it. I have a lot of skin in this game, and I'm telling you it's not fine. And I am worried. And I need my community right now. I need your help. So thank you for watching. Please stay tuned. There are going to be more videos. There is going to be more testimony from family members. And we have a very limited amount of time to encourage our lawmakers to do the right thing. So please call your legislator, write them an email, write a letter to the editor. Thank you. Have a good evening.